Hi, my name is Garrett Scarborough, and I'm an EMT student with First Response Training Group in Orlando, Florida. For this quick video, I'm going to give you a brief rundown of some common respiratory emergencies, treatments, and evaluations to ensure that they're effective. First thing that you're always going to do as an EMT student, because who wants to lose points for not doing this? Verbalize at least BSI and scene safety. Focusing just on respiratory emergencies right here, the first thing you're going to do is you're going to assess the patient's airway. If the airway is patent, you're going to be able to tell pretty easily by the patient will be speaking clearly, crying, coughing. Any of those things are moving air through the airway, and you can tell that there's enough air getting through to be a clean, clear, functional airway. With a patent airway, there's going to be ventilations that you have to assess for adequacy. The way you do that, one way, you can observe chest rise and chest fall with each breath. To ensure that you're getting proper perfusion, you can do a simple capillary refill test to make sure it's getting decent time on the refill. You're also going to check for cyanosis or anything that would indicate inadequate perfusion. If you have a patient who is struggling to breathe, who is not getting adequate respirations or ventilations, you could use multiple different things to make sure that the airway is clear. If the airway is obstructed simply by patient may have swallowed their tongue or something of that nature, you can try and open it using either the head tilt chin lift maneuver or the jaw thrust. The jaw thrust is going to be your go-to maneuver on any patient that you suspect a spinal injury or any other compromise like that. Once the airway is open, you can assist ventilations with a BVM. If the BVM's ventilations are effective and the patient is struggling to breathe on their own, the assisted ventilations will be enough to give adequate chest rise and chest fall with each breath. If there's a bad seal on the BVM around the mask, you'll be able to tell because there will be air either escaping from the edge of the mask around here, or there will be no chest rise, chest fall. One of the side effects that can come with improper BVM ventilation is gastric distension. Essentially, gastric distension is when you're moving air from outside the body to inside, but instead of being pushed into the lungs by the BVM, it's going into the stomach and inflating the abdomen, which does not help with oxygenation of the body. One of the ways you can fix gastric distension or improper placement or inadequate ventilations, you can reassess or reposition rather the airway, and at that point you'd want to consider getting some additional resources if that doesn't fix the problem. If the airway becomes obstructed by any vomit, secretions, mucus, anything of that nature, you can use suction to clear the airway. There's a couple different suction tips or catheters. You can use a Yonkers rigid suction tip. That's going to be probably the most frequent one that you would use. For example, there would be a hole in the top of the catheter. As you insert the catheter into the patient's mouth, you keep your finger off of the hole so that there is no suction through the end. Once the catheter is inserted all the way, then you would close off the hole, and using circular motions as you're withdrawing the catheter for no more than 10 to 15 seconds, you can clear the airway that way. The biggest concern that I'm aware of with using one of those suction catheters is if you insert it too far down, you could activate the patient's gag reflex. So if you have a patient who's having an asthma attack or any other COPD episode, essentially what's happening, the illness is obstructing the airway by constriction. And so you're going to use, after you obtain permission from medical control, you're going to use either vaporized steroids or bronchodilators. Albuterol inhalers are one of the most effective and definitely the most frequently used treatments for an asthma attack or exacerbation. Prednisone is also another good steroid that's used frequently for emphysema, bronchitis, things like that. The biggest effect that is achieved is reopening the airway because of bronchodilation. When the airway is constricted, or there's not enough air being moved through because the airway, the bronchioles and the alveoli, if they're constricted, you're not getting adequate perfusion. But because they're constricted, supplemental oxygen is not going to be adequate on its own to reoxygenate the patient. And so before you can really give them effective reoxygenation, you first have to give them some kind of steroid or bronchodilator to open up the airway before you can give them oxygen and expect it to be effective. There's a couple of different ways that you can give medications for that type of illness. There's what's called an MDI, it's a meter dose inhaler, and essentially what it does, it has a liquid medication in a vial below a piece that the patient sucks on as it's being pressurized and vaporized by your O2 supply. You're going to give them O2 at roughly the rate of 8 liters per minute or so, and the pressure built up inside the canister will be enough to vaporize it into a really fine mist that can work its way into the lungs or into the alveoli, the bronchioles, whichever system of the respiratory tract is having issues. Once that's done and the patient no longer has pulmonary constriction, then at that point you can give them oxygen and consider it good to go. So yeah, thanks for watching.